Next, it is my absolute pleasure to introduce Bobby. So Bobby is one of our patients at Sarah Cannon Research Institute that participated in a clinical trial for adjuvant therapy for patients with locally advanced melanoma. Bobby participated in a personalized cancer vaccine study that we hope not only provides benefit for him and for other patients with melanoma, but interestingly was also part of the foundational work to advance mRNA vaccines prior to the COVID-19 pandemic that allowed for more rapid development in the face of the pandemic. So first, thank you so much for joining us, Bobby. We all know how important it is to hear directly from patients to learn about their experiences. So Bobby, can you first just briefly tell us about your melanoma diagnosis and treatment?
I'll be glad to, and I'll just like to say that it's a privilege to be here with such bright and intelligent people, and their presentations have been very enlightening to me, even after going through all the treatments that we've been through and the journey that we've done. This has been very, very helpful to me as a patient and as a melanoma patient. First, let me tell you a little bit about myself before I get into the diagnosis.
Yeah.
I am a business person. I work for myself. I have for the last 32 years. My wife's name is Jenny, and she's my partner in life, and she's went through this journey with me too, and has been very supportive, as well as Sarah Cannon has very, very supportive, and we'll get into that a little bit more detail, but I'm very humbled and very blessed to be part of this. And I just want to share my testimony on the personalized part of my journey through this, and that we've gone through this journey. And I'm about almost at the 2-year mark from my time of diagnosis. And hopefully there'll be several more years to follow after that. So that's what we're looking for. Let me go back a little bit on the timeline. Around Thanksgiving of 2019, I had some things that the dermatologist needed to take care of, as per se, my wife, Jenny. As you get older, we know we grow things that we shouldn't grow, like warts and things like that. So I had some tags or lags or whatever you call them, and she's made me a dermatologist appointment, and I went to my dermatologist, and he froze several of them off, and that was a process that went just fine, except for the one that I thought was a wart on the end of my middle finger on my left hand. So after a few days, I took the dressing off and noticed that it wasn't healing like everything else, and that it got bigger and turned bluish black. So I showed my wife, Jenny, and she made me another appointment with a dermatologist, and went back a few days before Thanksgiving. And he said, yes, we're not dealing with just a wart or something like that. He said, we need to take a biopsy. This is around a few days before Thanksgiving, 2019. He did a biopsy, and he called me the Monday after Thanksgiving and gave me the news that, Bobby, we're dealing with an aggressive, invasive form of melanoma, and we need to move right away. Time is of the essence. And I said, well, okay, what's our next move? He said, I've got you lined up with a surgical oncologist. Her name was Dr. Freezy. And I went and visited her. I believe that was on a Monday or Tuesday after Thanksgiving. And then the following week, which would have been the first week of December 2019, she removed some of my lymph nodes off from underneath my left arm, and end results were they came back negative, which was a good thing. And then the very next day, on Tuesday, I had an orthopedic surgeon come in and cut off about 2/3 of my middle finger on my left hand. That's where the tumor was located, the melanoma. And visited my surgical oncologist a couple of times, and she went over a few things and said, you might be diagnosed as stage 2. I believe stage 2B or something like that. But you can get into more of that, Dr. McCain. I thank you for that. But she said you might be a good candidate for this immune therapy because after a while, I'm cancer free, and but you still may have cancer cells in your blood or whatever, and this immune therapy may help you over the long run because you've got a high risk of reoccurrence. My high risk of reoccurrence concerned me a great deal because I didn't want to have to deal with this again down the line in the way that we've had to start off with. So she sent me to y'all, Sarah Cannon. I've talked to several people there that I can't remember their names, but I signed a bunch of papers, went over a few weeks. They went over everything, covering side effects and stuff like that. And we started this immune therapy, I think in April of 2020, right before all this COVID stuff hit. And the first 5 or 6 treatments I had a couple of vaccinations, and then they would wait 30 minutes and they'd give me my drug, which was Keytruda. And that was done through an infusion and lasted 35, 40 minutes, sometimes 45. And the combinations of the 2 drugs over a period of year, we just finished up back in May of 21 with my treatments. And hopefully all the scans have gone good so far. So I'm very positive and very upbeat about it. And I'm very thankful and blessed to be involved in this. And I'm personalized it because I participated in a clinical study because I was recommended for it, but also from a selfish standpoint that I didn't want to have to deal with this down the line. And if I'm a good candidate, let's give it a try. And the high risk of reoccurrence concerned me a great deal. Anything I can do to minimize that risk, I wanted to be involved in. And we've gone through that. I go back for my next scan in December. We're very positive about that, and we hope it comes back clean, and we're shooting for the stars. And I've been very lucky and very fortunate to be involved with people that are concerned about you as a person and the way you feel, and listen to you a great deal to find out the way that you do feel controls about how you're being treated. And it's one thing I noticed going through all this, or several things I noticed, that I wasn't sick. I was cancer free. So I was being treated, and all the people were treated with respect and honor and stuff there. The real sick of the sick was getting their treatments. So it was very humbling experience to me to see how every person was treated with respect and honor, and that the best treatment possible they were going to get. Now, to get back to mine a little bit personalized, it's been a journey, and that's the way you got to relate it. It's a journey. It's something that you can't get over in a month or 6 weeks. I've been through a year's worth of treatment. I had a treatment every 3 weeks, an infusion, and I was cancer free. And that's what we're aiming to do, is stay cancer free. And I put my faith and trust in all these other guys that just got through talking about how the knowledge that they've developed over the last 10 years will carry on and be that much greater than the next 10 years. And the people at Sarah Cannon have been tremendously helpful, and they've just been supported to the point where they're part of my family now. And they're trustworthy, they're faithful, and they're concerned about you. They're concerned about your health. They're concerned about you as a person. I've been married for 49 years. I've got angels here on earth that help take care of me. One being my mother, who's still alive. My wife is my caregiver here at home, and she's my other angel. But there's a tremendous amount of angels down there at Sarah Cannon that give out good health and trust and hope. That's what they're dishing out, is hope. And I've talked to a lot of people down there, other case of cancer patients that come from all over to find the treatment that they need. And that's what I'm looking for, is the treatment that I need for the long haul. How did I decide to do this clinical study? Is talking to people and everything. I was interested in immune therapy, and that my high risk of reoccurrence is melanoma. And even my surgical oncologist said, you've got about a 50% chance that this is going to reoccur 2 to 5 years down the road. Well, I want to pay my dues and get treated and everything, but I don't want to deal with this 5 years down the road, or 2 years, or 3 years, everything. I may not be as lucky then. I just happened to be in the right place at the right time. And on God's gave me the introduction to people that could use me and use this as treatment for me, but also maybe treatment for others. And I'm very appreciative, and it's been a privilege for me. What kind of support? I've related some of that. The support of the staff and the team there at Sarah Cannon has been tremendous. It's a well-oiled machine. You're talking about this machines a while ago, Doctor. This staff is a machine too that's got their designated areas that they take care of, and they do that. And they work great as a team, and they know about the lab work and all that stuff goes on, but each person has a role to do there, and they know their role. And that's great. And it all comes together with the treatment of that patient. What advice would I give someone? Some advice. Don't expect to be better or treated overnight. It's a journey. My journey has been short compared to some others, but I'm still in that journey too. And I'm positive about it. I'm cancer free right now. I intend to do whatever I can with the help of others to stay cancer free. And so far that's been accomplished. And just to go back a little bit during my treatments, the treatments, when they did give me the vaccine, and that was over the first 5 or 6 treatments, they did have side effects. Mm-hmm. They knocked me on my rear end for a couple of days, and I couldn't get out of bed. But that was a sign to, as far as I was told, that they were working. I've never been as cold in my life as I have after doing the vaccinations. But I believe they were needed and they were important. Now, after I got off the vaccinations, the drug Keytruda was the infusion. And I think that's correct, isn't it, Dr. McCain? Mm-hmm. On the drug. I had very little side effects with that. So after several treatments and everything, I don't know if my body just coped with it or getting away from the vaccinations, but I believe it together as a combination that this thing's going to work. And I believe that it's going to work, and I believe it is working. And we got to have faith, and I believe that God has brought me to this point to stay positive. He has a plan for each one of us. And here on earth, he's put angels at certain places to help take care of us.
Thank you, Bobby. That was fantastic. I mean, I think the main takeaways is that obviously that you participated, right, to not only help yourself, help future patients. I obviously think your positive attitude and being hopeful helped you get through those days, right, that were like I think you told me I'd never felt so cold and never felt so hot. That 24 hours after treatment, and just trying to get that. And cancer treatment's a journey, and so recognizing that treatment's a lot, and having a good team with your family and a care team. I'm seeing some other messages from patients that just having that team and support surrounding you is really important.
It is, and I'm very appreciative and very blessed, and hope to get further good news in December when I have my scan. Go from there.
All right. I agree.
Keep up the good work, and I thank you for the And I feel very privileged and be part of this presentation, give my personal testimony. It's been very enlightening to have all these bright doctors who are working for me and other people that are patients, and I'm very appreciative of that. So thank you very much.
Well, thank you so much for joining. We really appreciate it, and just really so thankful that you were able to join us and help patients understand and what it is to undergo treatment and be a part of clinical trials. So thank you so much, Bobby.
Only last thing is talk to your doctor. They listen, and they have a lot of good helpers. And listening is a big thing to me. You don't need to do anything till you listen. And I'm very thankful for that. I'm very thankful for you.
Well, we've got a good team, and everyone. We're all here. We're all here trying to help our patients. So
that's right. That's right. You do that for every one of them. So I appreciate it.
Great. Well, thank you. Thank you so much, Bobby. We really appreciated it.